Thank you so much for being with us today on Joy in Our Town. I'm your host, Jeanette Allen, and it's always exciting when we have very, very interesting programming for you, and that's exactly what we have today. We're going to talk about diabetes, and that's a subject that most of us have heard about, but how much do we really know about diabetes? Well, we have with us Dr. Alan Garber, MD. He is the treasurer of the American Association of Clinical Endocrinologists. He has a wealth of knowledge because in addition to that information, he is also a professor at the Baylor College of Medicine right here in Houston. So, you know, we have a man with us who is just oozing with knowledge, and we're going to pull out all of the information that we can today concerning diabetes because that's our specific issue and our topic today. So I'd like to thank you so much for being with us.
It's my pleasure.
Great. Let's begin with a simple question that everyone needs to really know the answer to. What is diabetes?
Diabetes is a disorder of chronically elevated blood sugars. It leads to degenerative complications in a number of body systems, such as the blood vessels, large and small, the nerves, and ultimately a variety of other tissues, such as the eyes, the kidneys. And these complications are what makes diabetes the 5th leading cause of death by disease.
Oh, my goodness. So does it, you listed different areas of the body that's affected by it. Does it start primarily in one area or organ of the body or not?
Well, we start with a prolonged period of elevated blood sugars and no complications.
Okay.
And that's where we want to try and intervene as early as we can, because we know that for many of these complications, the elevated blood sugars leads inevitably to those complications, and that by lowering the blood sugars, we can block the development of those serious complications.
Right. So what is it that an individual is doing that causes the blood sugar to be elevated?
Well, you have to have two possible explanations. The first is we know diabetes runs in families, and we know that there's at least a dozen different genetic issues that have been discovered that associate with diabetes.
Right.
They're different in different minority populations or ethnic groups, but they're all associated with the insulin-producing cells of the pancreas.
Okay.
Now, to bring that out, you usually have to have some problem in the pancreatic environment.
Okay.
And that's usually chronically overworking it as a result of being overweight or, worse, being obese.
Okay. Now, you know, I always thought that diabetes would present itself if someone ate a lot of sweets.
You know, if you eat a lot of sweets but you don't gain weight and get fat, you're not necessarily going to get diabetes from that.
Wow.
You may get a lot of tooth decay, but the diabetes may not be the problem.
Now, isn't that something? I have heard that different times for years. And so when people have diabetes, are they still able to eat desserts or not?
Well, we like to reduce the sugar content of the foods, and so we may try and find desserts that have reduced sugar intake.
Okay.
Or perhaps we'll use artificial sweeteners.
Okay. So if I don't have, no, let me change that and ask this way. You mentioned different ethnic groups have different problems or can have different problems with diabetes.
Yes, ma'am.
Is diabetes prevalent more in a particular race than another?
That's a really good question. I think our viewers need to know that some elements of the American population are extraordinarily high risk for diabetes.
Okay.
If you're a Native American,
yes.
certain tribes in the United States have almost a 50-50 chance of becoming diabetic by the time they're 40 years of age.
Wow.
On the other hand, if you're Latino or Asian,
mm-hmm.
you have about a 30% risk of becoming diabetic
okay.
As an adult. If you're African American, about a 20% risk.
Okay.
And if you're a Caucasian of European ancestry, maybe about a 10% risk.
Wow. Why the difference?
It seems to have to do with how sturdy or durable the insulin-producing cells of the pancreas happen to be.
Okay.
In whites of European ancestry,
mm-hmm.
they seem to have pretty sturdy beta cells.
Okay.
But if you look at Native Americans,
mm-hmm.
they really deteriorate very quickly.
Wow.
So in that population, if you see some early signs of perhaps pre-diabetes before
yes.
they're really diabetic, you need to act right away
mm-hmm.
because you only have a few years before they become overtly diabetic.
Okay.
In African Americans, you may have a decade or two.
Mm-hmm.
And that tells us what our window of opportunity is to try and prevent diabetes.
Right. Now, here I go with something else that I have seen, but I looked at some programming, and it was concerning Native Americans and their onset of diabetes and how prevalent it was, just as you just shared with us. But they also related it to their diet, which didn't have a lot of vegetables in it. It had more starchy foods. And they said that they also found that when the American Indian changed their diet, began to walk more, and things of this nature, that the diabetes resolved itself.
Well, I think that the emphasis should be on the changing diet and walking more.
Okay.
And not necessarily the starch. There's an interesting study of Pima Indians
okay.
Who live on the U.S. side of the Arizona-Mexican border,
mm-hmm.
and their cousins who live on the Mexican side.
Okay.
The Arizona Pimas have a tendency to be markedly overweight,
okay.
Fairly sedentary.
Mm-hmm.
They have a high alcohol intake, by the way.
Okay.
And an incidence of diabetes well over 40% in adults.
Okay.
In the Mexican side of the border,
mm-hmm.
they tend to be normal weight,
mm-hmm.
and they have a 8% risk of diabetes because they're working all the time, okay. farming and trying to make a living.
Okay.
It's clear with the same genetic background,
right.
two different lifestyles produce two distinctly different rates of diabetes.
Isn't that amazing? So our choices have a lot to do with it as well.
Yes, ma'am.
Okay, so now we understand what diabetes is. We understand how it presents itself. So what can I do as an individual to make sure that it does not happen to me, that I don't receive that diagnosis?
So can't change our parents. That's
no,
pretty clear.
Too late for that.
So the only other thing we can do is work on the factors that bring out
exactly
our risk. And that's mostly the sedentary lifestyle and the overeating that characterizes most of our society.
Yes.
Can't change your work. You can't make your computers all portable and
right.
do your work while you're jogging. But you can reduce your calories.
Yes.
And you can find some time to go for a walk every day.
Mm-hmm.
You know, 30 minutes of walk every day will reduce body weight by 5 to 10% and will reduce your risk of becoming diabetic 50 to 60%.
Mm-hmm. Okay, now there's something that we need to learn from you concerning type 2 talk.
Yes, ma'am.
What is type 2 talk?
Well, it's a website that the American Association of Clinical Endocrinologists has set up in association with some commercial support from manufacturers of diabetes medications to try and facilitate the interactions between patients with diabetes and their physicians. Now, we all know that doctors have less and less time to spend with their patients, and
yes.
frankly, some patients are reluctant to question their doctors.
Mm-hmm.
And this is not good for either side. I mean, if you don't ask me the right question, I may not
Think about it. Right.
Everything that you need to know.
Right.
And I may assume you already know it.
Mm-hmm.
So here is a website that people can dial up that will help them focus on the right questions for them.
Okay. So when the information that they give is all related to diabetes, and probably some of the information might result in us asking questions that otherwise we may have never thought about.
Well, I think that's absolutely critical, because patients have somehow forgotten about taking charge of their own illnesses.
Mm-hmm.
And frankly, if you're diabetic or if you have high blood pressure, it's your high blood pressure or your diabetes.
It is.
It's not the doctors, not the insurance companies. It's your disease.
Right.
You need to learn how to manage it.
And I have to accept responsibility for it.
Yes, ma'am.
Perhaps my choices resulted in my having that disease, and likewise my choices can result in either the disease leaving or becoming markedly better.
You can make it good or bad depending upon what you do.
Yes.
And so it's up to you as to what kind of diabetes future you have.
It's in my hands.
Yes, ma'am.
Okay. I need to let our viewers know how they can contact you for additional information. So if you excuse me for just a moment, I'll do that, and then I'll come back to you. How about that?
Please. Okay.
We're talking with Dr. Alan Garber. He is the treasurer of the American Association of Clinical Endocrinologists. He's also a professor at Baylor College of Medicine. So you see, he has a wealth of knowledge. How can you make contact for additional information? By jotting down this website. So I hope you have a pen and pencil ready. The website is www.thetype2talk.com. www.thetype2talk.com. Now, realize that some of our viewers may not have a computer. You may not be computer literate, but if you'll write that web address down and put it aside when your grandchild or your children come in and they are computer literate, tell them, ask them if they would please pull that website up for you and print out any information that's printable so you can sit down and read it at your leisure and really digest it and come up with questions that you can ask your doctor whenever you go to see your doctor. Oftentimes we go to see doctors, but we don't ask anything. Just whatever they say, we say, okay, okay. And then we go home and our children say, well, what did the doctor say? And we say, well, I really don't know. Well, did you ask the doctor? Well, no, but he said or she said for me to do this or that. So we're going to become much more proactive in this new year when we go to the doctor, okay? Well, Dr. Garber, it's been great having you, and I want to just ask you to stay here for just a minute. We're going to take a break, and we'll be back with much more joy in our town. So please don't leave us. You know we don't do well when our viewers are not here. So stay tuned, and we'll be right back. Thank you for being with us on this segment of Joy in Our Town. I'm your host, Jeanette Allen, and today our topic is health, and our issue is what is type 2 diabetes. We're also talking about how do you live with type 2 diabetes? What does life look like when you have that diagnosis? And to help us to understand that, we have with us Dr. Alan Garber. He's a treasurer of the American Association of Clinical Endocrinologists, and he's also a professor at Baylor College of Medicine. So he has all the knowledge that we need in the area of diabetes. So thank you for being with us on this segment of Joy in Our Town.
It's my pleasure.
Wonderful. Now, we need to know, we've talked quite a bit about diabetes. We know what it is and things of that nature. But once you have that diagnosis, how do you live with it? What does life look like?
It should look essentially unchanged from pre to post diagnosis of diabetes, except that you don't want to take large quantities of simple sugars in your diet. So, for example, bottled soda pop. It would not be smart to have large amounts of raw sugar in the form of soda pop.
Okay.
So either diet sodas or, better yet, water.
Okay. Water has no calories.
Yes, ma'am.
Okay. So what about our food intake, our portion size, and what kinds of food should we consume in comparison to others we should not?
So you mentioned portion size. Now, that's a critical issue because so many of the reasons why we tend to be overweight has to do with eating too much of the food rather than the wrong foods.
Oh, okay.
And it's just too big a portion size. You go to restaurants and take home a bag or two of food because you couldn't finish it all. Well, you should never have gotten that portion size in the first place. I remember that dinner plates used to be small.
8 inches.
Yes, ma'am. And now they're 10 or 12 inch
10 and
plates.
12. So those are actually platters.
Yeah.
That we put out for dinner plates, but now they're platters.
And we fill them up.
Exactly.
And so, you know, we've lost the sense of when we're full. Your stomach has to hurt before you stop eating.
Right. And we think we're full when the plate is clean or the platter is clean. But I remember that as well. When the table was set for dinner, we used 8-inch plates, and we used the platters to put all of the food on. Those were what we served ourselves from, not what we ate off of.
Now we're eating from the platters.
Exactly, and thinking it's a plate.
So we're getting bigger as a society. And so all of those latent defects in our genes that predispose to diabetes are being brought to the surface by being too sedentary and working on computers or watching television and eating food beyond what we need.
Right. So if we serve our plates moderately and eat moderately, we can always come back later if we get hungry and get some fruit, I assume, or something of that nature. Just a little something. It doesn't have to be another meal necessarily.
I would recommend that we don't snack between meals.
Okay.
And that I have never, ever lost a diabetic patient to starvation, not a type 2 diabetic.
Good point.
So reducing the amount of food is a good idea.
Okay. And I think your point about snacking is very well taken, because I think when we snack, we sort of forget how much we're eating in the run of a day. So we eat our meals and then we're snacking all in between. If we don't pay attention to ourselves, we are constantly consuming food all day long.
And a lot of it is high-calorie food, especially things that we think are healthy, such as nuts or trail mix or those sorts of things. It's 300-400 calories in a little bag of trail mix.
Okay.
And nuts are very high in fat calories, particularly. And so our total calorie intake escapes us. We just don't know what we're eating. But the average woman probably doesn't need more than about 1,200 to 1,500 calories a day. That's like one or two trips to McDonald's.
That's not
or
much.
Or one of the other fast food restaurants.
That's not much at all. Now, what about medications?
Medications come to do two things. They either make the insulin that your body produces more efficient, or they help your body make more insulin to control your blood sugar. And we used to have only injectable insulin, maybe one family of pills, but now we have 6 or 7 different families of pills. We have multiple injectable medications, and life need not be difficult if you have diabetes and you take your medicines. It's not all a diet and exercise battle. It's some diet, some exercise, and some medication.
Okay, a balance.
A balance of approach, yes.
Okay. Now, we've talked previously about the website where our viewers can go and learn more about diabetes, learn what questions to ask their doctors when they go. So when they go to the doctor, what questions should they really ask concerning eating, concerning their medication in particular? Sometimes I think the doctor may give the person a prescription. They use it, they decide, ooh, I feel woozy, and they decide themselves not to take it anymore. Never tell the doctor. I don't think this is a good idea, is it?
No, you're absolutely right. This is a big mistake. The doctor may think you're still taking your medicines, expect you to be doing well. You're not doing well. And so he or she may be puzzled as to what's going on.
Right.
You need to tell the doctor what symptoms you had, what problems this medicine created. You can look it up on this website and learn more about the medicines that you're taking, learn more about the diet, learn more about exercise. But more important, you can learn how to take charge of your diabetes. The website, the Type 2 Diabetes Talk, is very important for patients to try and take ownership of their diabetes. It's not their doctor's disease, it's their disease.
Right. Right. So when we go to the doctor, even though he or she tends to be very busy, running late, comes in late to see you, and you have all these obstacles to endure, we need to grab hold of that 1 or 2 minutes that we have with our physician and come into the office with specific questions, not a paragraph, but bullets. Just clear, concise questions, and say, doctor, I'm having this symptom. What does this mean? Well, this has occurred. What should I do? And so when the doctor hears those specifics, it will cause the physician to focus in on me rather than possibly be focused on the person that they just finished seeing in the next exam room.
You're exactly right. And by the way, they should bring all their medicines with them too.
Okay, good.
Including the herbal preparations or vitamins or whatever else they're taking.
And bring it in the prescription container?
Yes, in whatever bottle it comes in.
Okay.
Bring it in a sack so your doctor can see what it is you're taking.
Okay.
Because some things don't interact well with your other medications, and they may be very hard on your liver, particularly especially if you have diabetes.
Okay, that's excellent to know. Bag up all your medications and take them with you to the doctor. Don't try to tell your physician what you're taking and how you're taking it, but take it in your prescription containers, in your prescription bottles. Now, www.thetype2talk.com. That's available for all of our viewers to get much more information about diabetes. So what's the advantage of that website?
Well, it's sponsored by the American Association of Clinical Endocrinologists, and we're the largest professional society dealing with diabetes in America because we're the society of practicing endocrinologists, 5,000 of us in the United States, and we are the people who primarily deal with diabetes and other endocrine disorders.
Right.
It is in our best interest to have our patients fully educated.
Yes.
So that when you come visit us, you get the most out of our interaction time. It's going to help our patients. And after all, if it helps our patients, it helps us.
Of course it does. So can they only get information like what is diabetes, or can they glean information concerning eating habits, medication? Are there a variety of things there?
Yes, ma'am. And if they can't, then there'll be links to other sites that will help them explore further the world of information that's available to them regarding diabetes. And frankly, on the internet, there's a huge amount of material that you can find if you only take the time to find it.
For the sake of our viewers, I'd like for you to get pen and pencil ready, or pen and paper might be better, so that you can write down the web address that I'll give you very shortly. And I realize that some of our viewers may not be familiar with a computer or may not have access to one. But even if you don't, if you would jot down this information, and when someone comes by that you know that does have a computer, or they know they're more skilled at using the computer than you are, if you'd ask them just to pull up this website for you, and whatever information is printable, just print it out, and then you can sit down at your leisure and read through it and get very educated and very familiar with what's available there for you. Now, hopefully you have pen and paper now, and that web address is www.thetype2talk.com. And if you look at your screen, it's also available for you to copy there. Again, it's www.thetype2talk.com. the type, and then the number 2, talk.com. Dr. Garber, we just have just about a minute left. Any other tidbit of information you'd like to leave with our viewers today?
So the key information here for our viewers and for every patient who has diabetes is that what happens to them as a result of diabetes is up to them